Good day, my name is John Clarenze Anlites, and today I'm gonna perform the on-chest physiotherapy. So the first thing to do is to verify the order. This to prevent some potential errors. The next is to confirm the client's ID to compare it with the name of the client's bracelet tag. Then, it is for the checking to identify ensures the client's safety through the concept of correct procedure for correct client. The next is to provide the privacy, then explain the procedure to the client. Then, wash your hands, don gloves, and a face shield gown, and following the standard precautions. It is for the safety for both nurse and the client. So, the next step is to auscultate the patient's lungs. So, sir, may I assist you to sit down, sir, and leave on the bed for it, sir. If there are any abnormal hearings or findings, record it. So next is to position the client as ordered. It is generalized disease. Drainage usually begins with the lower lobes, then continues with the middle lobes, and ends with the upper lobes. In localized disease, drainage begins with the affected lobes and then proceeds to the other lobes to avoid spreading the disease to uninvolved areas. So right now I'll be showing the different positions of the client. So the first position would be the upper lobes, apical segment. Next, sir, is to lean forward. Then sir, lie down. So next would be the posterior segment. So sir, mukulog to sir. Dayon, kailangan mo, elevate lang ko naman. Wait, on lang. Flat yun sir, liit na siya. Then naka-elevate niya siya dire gamay. Then the next would be flat dip. Then imong arms. So the next step would be the middle lobe. First, the patient's feet must be elevated, supported with pillow for comfort. So for the right, the foot must be, the other one must be facing there. Then for the other side, patient must be right here. So the next would be the lower lobes, the basal segment, the right and left anterior. So the patient must be straight, foot must be elevated, supported with pillow for comfort. The next is the right and left posterior. So sir, kulog to sir. So the patient must be also be flat, and the foot must be elevated and supported with pillow for comfort. So the next position would be the lateral segments. So the same with the foot, it must be elevated, supported with pillows for comfort, but the patient must be facing right here, and the arms must be elevated. So sir. And the same for the other side. And lastly, it would be the superior segment. So the patient would be facing down flat. So sir, pwede ito makulog. And the patient's hand must be here. So those are the various postural drainage positions are used to mobilize secretion from the specific lobes and segments of the lungs. So those are the various postural drainage positions that are used to mobilize secretion from the specific lobes and segments of the lungs. So the next step would to instruct the client to remain in each position for 10 to 15 minutes during this time to perform the percussion and vibration of the lungs. So, to perform the percussion, instruct the client to breathe slowly and deeply using the diaphragm to promote relaxation. Hold your hands in the cup shape with the finger flex and thumb pressed tightly against the index fingers. Then, percuss each segment for 1 to 2 minutes by alternating your hands against the client in a rhythmic manner. Then, listen for a hollow sound in the percussion to verify correct performance of the technique. So next is to perform the vibration. Ask the client to inhale deeply and then exhale slowly through pursed lips. During exhalation, firmly press your fingers and the palm of your hands against the chest wall. Tense the muscle of your arms and shoulders in the isometric contraction to send fine vibrations through the chest wall. So, vibrate during 5 exhalations over each chest segment. So, sir, pwede ka maginawag na mo. Exhale. Inhale. Exhale. After the postural drainage, percussion, and vibration, instruct the client to cough to remove the loosened secretion. First, tell the client to inhale deeply through the nose and exhale through the mouth in 3 times short coughs. So, sir, pwede ka inhale og lalom, sir, tapos mo exhale ka nga pinaubo 3 times. So, sige, sir, inhale nga lalom, then ubo ka tulog. Sige, sir, isa pa, sir. So, have the client perform the coughing exercise for about 1 minute and the rest for the 2 minutes. Then, gradually progress to a 10-minute exercise period for 4 times daily. Try to schedule the last session just before bedtime. Then next, if the client's cough is ineffective, suction the client. Then next is to monitor the client's response to the treatment. You should be alert for significant color changes, particularly if the client becomes dusky. The next is to dispose of secretions appropriately. Then provide oral hygiene to the patient. Then auscultate the client's lungs. Then record if there are any abnormal findings. Then record the date and time of the chest PT, which chest segment were percussed or vibrated, the color, amount, the odor, the viscosity of any secretions produced, and the presence of any blood in the sputum, and any complications and nursing actions taken, and the client's tolerance to the treatment.